Thank you. Good morning, everybody. I love to see the snow. This morning seemed to be a pleasant day, and suddenly I feel very depressed. I have this extraordinary sense of déjà vu. 25 years ago, I was based in Sarajevo, and I thought we would never see anything as bad as that again. A few years later, I had to go to Rwanda, and I realized that we always get there too late. And then, ironically, a few years ago, not so long ago, I was based in Syria, arranging for Iraqi refugees coming into Syria. I think we're on the verge, as Father Michel started out saying this morning, we're on the verge of a devastating era. And the more I think about it, and the more I look at the numbers, and the more I look at the situation in that particular part of the world, but others as well, I realize that we really are entering into an era of massive displacement of populations and destruction of societies. So against that backdrop, let me just run through some things. I was asked to talk about the pre-displacement situation rather than anything else. One of the things I think that we have not been at an international level able to do, and which we must do, is to begin to be more realistic about the magnitude and the strength of the push and the pull factors. Now, the push factors are becoming very obvious. The push factors are the conflicts, extreme chronic poverty. But what are the pull factors? The pull factors are that Europe and other parts of the world have created a mythology about how well you can be, how comfortable life can be in another part of the world. So we're going to continue to see massive migration, not only of refugees, but also of people who are forced to flee because of poverty and chronic poor health. I think we've also got to be realistic about the changing policies and attitudes. 25 years ago, when refugees fled from Bosnia, they were welcomed all over Europe. People went out of the way to receive them. Since that time, since 1995, the situation has changed dramatically. Refugees, migrants, are no longer really welcome. We have to also be very clear that massive migration also presents security threats. Not necessarily security in terms of terrorist activities, but security in terms of simply not having enough resources or being able to allocate enough resources to the people in need. Not only receiving countries, but also, as we've heard this morning, the sending countries. I think we've also got to be realistic about the potential that exists today for rejection of refugees and migrants. The growing narrative about sending people back. Sending people back where? To what? I think we've got to be very realistic about not only how unethical this is, but how politically and socially developmentally dangerous that narrative is. There is no question about sending people back. And also I think we've got to be realistic about the context of tremendous political confusion and chaos that exists in receiving countries, in sending countries, and in observing countries. No one is clear as to what to do. No one is willing to come together around a common policy and philosophy. Now, I think we've got to think about this migration process, obviously, as a very multi-stage process. And we need to keep in mind that whatever happens at the time of departure may color, may characterize, will influence anything that happens afterwards, including the capacity for social integration. Now, up until now, we have tended to focus, all of us, on the acute stage, on these dreadful scenes of people in boats, or in other situations, people at the height of a crisis. I think that today we can say that only the resilience of the people that are moving, the personal, physical, psychological, and social resilience of these people has been able to prevent a much bigger disaster than we have seen to date. And that disaster may be on the horizon, because resilience is time limited. So now I'm going to be very pedantic. When people are beginning to move, when people are gathering together at ports and so on, what is it that we can do? Very simply, I think we've got to begin to be much more proactive in warning people about the dangers that they're likely to encounter. I think we've got to prepare people physically in a much more active way than we have done in the past. And there are certain basic steps that can be taken in terms of providing security, providing food and water. And some of you will say how simplistic this is. It isn't simplistic when you're there on the front lines and you know what's going to happen over the next few weeks and months as people try to make it from one part of the Mediterranean to another. I think we've also got to focus much more on the psychosocial aspects of this process. It is very clear that many of the refugees and migrants are simply not prepared for what is going to be waiting for them when they get to the other side of the Mediterranean. We also need to pay much more attention to trying to keep families together. I'm a big believer in the fact that families that are united are families that can survive better. Families that are united are able to look after each other. Right now we're seeing a very disoriented, disorganized situation in which families are being disrupted, in which people are beginning to move alone. Nothing could be worse than that for the future of these refugees and migrants if we allow that to continue. In terms of surveillance, and I think that the last speaker began to talk about this in a way, I think we've got to be much more clear about looking, this is at the point of departure. This is for the NGOs and the others who are working on the ports, is to look out for health risks. We need to begin to categorize people in terms of health risks. Some of the people may say we also need to be looking at social and political risks. I think the health risks are much more important. We need to begin to provide basic care and basic medical records. People are arriving in Greece, in Italy, in other parts of Europe without any medical record. And you can say, fine, you give them a medical exam and you give them a medical record. There isn't time for that. So the best time to do this is at the point of departure, of trying to make sure that people leave with some type of piece of paper that says who they are and what their medical conditions are, what types of treatment they've been on in the past, and to provide some type of counseling with regard to that. Counting and registering is something which is inimical to refugee movements. Unless you can count, unless you can know who is moving, you will never be able to have a surveillance system that tells you who is not surviving, who needs what, when and how. So at a political level, I think that one of the things that we desperately need now is to come together, as we're doing today, but even higher level, of sending countries, transit countries and receiving countries together with groups like this, basically to begin to look at what are the aims and the policies that are going to govern our work for the next 10 to 15 years. As I said, this is a problem that's not going to go away. It's a problem, as Father Michel said, that's going to get bigger. We do not have any common aims or policies today as to what to expect, what to aim for, and what we're willing to do. Unless we can come together and do that, it's going to be a very chaotic situation for the next few years. So who is going to articulate all of this? The international community, for me, is the UN agencies. They must be instrumental. They must be basic to this. Faith-based organizations, multi-faith organizations. We must ensure that whoever talks about this problem and tries to deal with this problem from a faith-based perspective, it must be very ecumenical. And from a governance perspective, we do need to have a bigger involvement of law enforcement agencies. The reason why so many people are leaving and the conditions in which they're leaving today is a result of, in great part, of trafficking. This has become a major industry. I remember working at the Kosovo crisis and seeing Mrs. Sagata from UNHCR very courageously giving a press conference in which she said, refugees must be kept and encouraged to stay close to Kosovo because they will go back within 6 months. She was right. She could have been wrong, but she was right. But 10 kilometers down the road, there were major trafficking organizations already picking up busloads of young women and taking them to Switzerland, to Italy, and other parts of Europe for sex work. So trafficking has become a major industry which is playing a big role in this. And finally, I will skip this, but I'm just going to draw your attention to this chart. This line, horizontal line here, is the line of necessary reproduction of a society. That is to say that this is the number of births that we expect in society for a society to be able to survive socially, economically. It's called the replenishment line. These lines here are what has happened in Europe. There is no European country that is going to be able... Europe is a dying continent. Demographers will tell you that unless Europe can increase its population tenfold, 17-fold, the World Bank says, we will not be able to maintain insurance systems, pension systems, economic development. And here we are, while we're looking at this, confronted with the biggest opportunity that Europe has ever had to replenish society. And Mrs. Merkel, who everyone likes to criticize, Mrs. Merkel is very wise. I think Mrs. Merkel is not only humanitarian, but she's also a great demographic economic pragmatist. She has understood that the arrival of migrants and refugees is probably going to save Germany. Economically, from a labor perspective, and socially. And that is the same for the rest of Europe. But the rest of Europe doesn't have Mrs. Merkel. Thank you.